Hi, everybody. I'm John Simoes for Protect Our Care New Hampshire. Well, following a 40-plus day government shutdown, confusion remains for Granite Staters navigating open enrollment in the healthcare marketplace. So today we're going to explore where we are with open enrollment, what we know about the enhanced premium tax credits, and why those are vital for keeping insurance, affordable to New Hampshire working families. Before we start, just a couple important notes that open enrollment is indeed underway from now until January 15th, 2026. But if you want your coverage to start January 1st, you need to sign up for a plan by December 15th. And yes, there is some anxiety around premiums due to uncertainty, poor information, and obviously cuts, as well as the recent shutdown. And for the record, New Hampshire has approximately 65,000 marketplace enrollees as a baseline. That's not including Medicaid expansion. Well, today we are very happily joined by Randy Hayes, convener, Ken Street Coalition Healthcare Working Group, and again, from by our friend Christin H, founder and principal of Putney Consulting. It is so great to have the two of you here with us today. These are confusing times, and I'm hoping that together we can shed a light on what's going on with open enrollment and maybe kind of debunk some of the myths and some of the confusion. Um, let's start, Kristen. What do you think our neighbors, Granite Staters, need to know right now as they log into the marketplace? What do you see is going on? It's been 18 days? And there's not a lot of information coming out of Washington about where we are. What do you see?
Well, I think the most important thing that we want to let everyone know is that the marketplace is open and it's open for a certain amount of time. And the low income special enrollment period, I don't think is going to exist anymore as well, which means you have to, whatever your income, you need to enroll during this period. And there's help available. There are navigators in the state of New Hampshire, but there are not that many. And so go online and start looking at your options. Look at there are price comparisons, plan comparisons, see where your current providers are, and inform yourself first as much as possible, and then reach out to the navigators and be patient because they are there to help. There's no cost. And I think that's the most important thing to think about.
Kristen, let's talk a little about these enhanced tax credits. We hear a lot about them. It's become a political hot potato, but many people in New Hampshire rely on them to have a plan that they can afford to be able to cover their family and their kids up to the age of 26. What can you tell us about these enhanced premium tax credits?
Well, so the enhanced tax credits offset some of the cost, and it depends on your income for individuals or families. So if they expire, people with incomes that are below 4 times poverty level, so that's about 60 to 63,000 for an individual and 128 roughly for a family of four, will continue to see the tax credit, but the amount of financial help they receive could be significantly less. There's also older adults who don't qualify by age for Medicare. They really have benefited from this because they're not qualifying for Medicare, but they're able to receive tax credits. And so they're going to see premiums increase or they won't have any offset. Then the tax credits had a limit to if you assumed your income and you received credit, and then at the end when you file your taxes, you had to pay some of that back. And that is being eliminated, the limit on how much you would pay back. And so anyone that works in gig economy or works privately or is self-employed or works shifts who don't have like a really solid understanding of what their income is going to be for the year could be right on this edge between receiving a certain amount of assistance and having to pay back a full large amount because they were just over, they just underestimated their income for the year. So those are huge surprises that come for a family or an individual, that if you can't understand how that's going to happen, or if you're on a fixed income, you really can't budget over the year to be able to afford that.
Well, thank you. Randy, let me ask you, I know that you've been talking to people about the Affordable Care Act and what's going on with open enrollment. Did this recent federal shutdown, did it have an impact on public confidence in the ACA or on health rather, enrollment efforts from what you're seeing and what you've heard?
Thank you, John. And thank you, Christin, for your background information. Let me say that the shutdown was a symptom rather than a cause of a lot of what's happening. There's been such antipathy towards the Affordable Care Act in Congress that the confusion we have now, I would characterize as very deliberate. In other words, when you cut funds for the vast majority of free, unbiased navigators in our state, and to my understanding, we have one who's accessible at the website full words, newhampshirenavigator.com, working out of the Foundation for Healthy Communities. And when you call that number, what you hear is, or do that email, what you gather is that they're so short-staffed that they refer you to the website. But it's a very deliberate amount of confusion we have, directed primarily towards the Affordable Care Act in general. So I would say that the potential for suffering for individuals who are, as Christin said, self-employed, seasonal, retail, hospitality industry, these folks are making enough money that they don't qualify for Medicaid or Medicaid expansion, but they do not have an employer's insurance available to them. And with the enhanced tax credits up to this point, many people, hundreds of thousands of people in the country, actually the figure is 24 million are getting insurance through the ACA now, and 22 million are getting these kinds of subsidies. So we have deliberate confusion, and we have uncertainty, and we find people being asked to sign up for plans where the premium could be 20% higher to 70% higher. One quote I came up with that was pretty amazing is people who are just too young to get Medicare, a couple, and make 90 some odd $1,000 a year. Their ACA premium without the subsidies will go up $14,000. So we have
A year.
vulnerabilities among people who are just wealthy enough, just enough assets to be ineligible for Medicaid. And then we have folks who are on the verge of getting Medicare during their aging, but are no longer able to access an employer funded plan. And both of these groups are being asked to face incredible uncertainty right now about how they're going to insure for their health going forward. And the answer is not clear, even now.
But Randy, given your background, do you have any advice for people like that who may lose coverage because
Uh,
of this or think they don't qualify?
well, I think you've got to try to get as much information as you can and stay tuned. Some people have chosen to sign up early for a plan and just go down, say, from a silver plan to a bronze plan and work that into their budget. But for many people, it's estimated 20,000 of the 70 some odd thousand who are on the ACA in New Hampshire are going to lose insurance. They're just not going to be, they're going to be unaffordably having to withdraw from the insurance market. That doesn't stand as much risk for a 28-year-old who's no longer able to get coverage from their parents. But what about a 58-year-old? What
Yes.
about their family? This is a terribly confusing and unfair circumstance for people who are in those groups we mentioned. 95% of employers in New Hampshire have 50 or less employees, small businesses. These are folks who often can't afford a large subsidized employer plan, but count on the ACA for their own coverage as self-employed persons who own the business
Mhm.
and for the 50 employees. What's going to happen to them when they're priced out of the market? It's just unbelievable. And so we're getting ready for all of the downstream impacts in the healthcare profession of having large numbers of people uninsured and underinsured, anxious and forced to delay essential care until they wind up in very crowded emergency rooms and in hospitals without capacity to take care of them.
And real staffing shortages, which is the other side of
Unbelievable
it.
staffing
You know,
shortages. Right.
Kristen, let me ask you a question. We've been reading about significant premium increases this year beyond and without losing the tax credits. Can you talk a little bit about what's driving those increases in premiums? Why has everything become so much more expensive without any changes to the ACA in terms of tax credits or subsidies?
Well, I mean, it's very interwoven, certainly. It, some of the things that are going to happen that are going to drive premium costs, because within the insurance exchange and out of the exchange, there's a lot of balancing that the government has put in place through the Affordable Care Act in order to make it that not everyone who's lower income or more sick is in the marketplace, and therefore those plans have more risk. And so they're trying to spread risk across, which makes it fair and more transparent. But if these changes go into place, people are either going to pick maybe a higher deductible plan, right? Or if they're healthy and younger, they're going to take the gamble that they don't need insurance. And so when those costs are expended, if you end up in the emergency care room and or there's someone who's maybe on who does qualify for Medicaid or Medicare, the cost just gets spread to everyone else, right? And so if you get more sick people in then or people that are getting urgent care, then you're spreading more cost at a time when everyone else can least afford it.
Thank you. That's helpful because I think it's important to see that there's a lot of things going on at the same time. Before we go to some media questions, I just want to point out for those listening in that there are four insurance companies in the marketplace this year: Anthem, Ambetter, WellSense, and Harvard Pilgrim. And all those plans can be visible with your HealthCare.gov account. It's important to go into HealthCare.gov and update your income projections for 2026 to see what kind of subsidies you get or what tax breaks you may be able to get if they are renewed, and there's going to be a vote on that. But then you can also choose your physicians, your optometrists, and see if they're covered under the plan. There's some really good tools in healthcare.gov, and that's a really good place to start. Insurance brokers are able to help you as well if you have questions, but as Randy said, there is a New Hampshire Navigator program, and you can call them if you don't want to go online. I'm going to read their number. It's 877-211-6284. That is a free service. They cannot sign you up and they can't recommend a plan, but they can help you go through your options so you can make a smart decision. We'll try and come back in a couple weeks and see we are, because this is really important. As we've been talking about, 20,000 people in New Hampshire rely on subsidies, 60,000 people get their health care through the marketplace. And that's an important number because our medical system in New Hampshire, especially rural New Hampshire, is really struggling right now, and they need people to be insured. And that's important for all of us, not just some of us. Rachel, good to see you. Did you have any questions from media that you want to ask of our panelists?
Yes, thank you, Jaime, and thank you to everybody for joining us today. If any of our media have questions for our speakers today, I invite you to drop those in the Q&A box at the bottom of your screen. If you have a question for a particular speaker, please just note that at the beginning of your question. Now, our first question was submitted ahead of time by someone who couldn't make it today, and that is for both of our speakers today. How can the state and federal government improve communication to reduce confusion and ensure continuity of coverage?
Great question.
Well, I'll take a stab at this. The communication really is key, right? If people have, if they're confused, if they don't know where to go, if there are less navigators, then organizations that have ways of reaching members, people that are already paying attention to their message, can come together in a coordinated way to say the same thing, and just reinforcing how to contact, reach out, and get the information you need in a consistent way across different organizations that have different audiences. That will just consistently reinforce for everybody how to find information, because this is a time determinate amount of time that you can enroll right now. And so it's really important.
I would add to that that there has to be a bipartisan effort to, first of all, look carefully at the proven scientific data that we have about how government-funded healthcare works, where's the excess spending, where's the insufficient spending. If your ultimate goal is to help people receive healthcare that is accessible, affordable, and high quality, I don't believe you can have increasing amounts of private equity firms who own this supply chain, whether it be drugs, hospitals, or physician practices. And I don't think that you can treat healthcare in general as a commodity that's responsive to market forces. Because if we've proven one thing, both in terms of our own outcomes and then in comparison to other developed countries, it's that if you are making decisions that by and large turn on profit and on the translation of economic power into political power, which is what happens all the time in policies as they make sausage in Washington, D.C. And you fail to address the fundamental issues that people have a human right to health care. And it is essential to the common good, whether we're talking about decreasing violence in our society, increasing cooperation and effective assistance with various vulnerable people. If those are your goals, then you have to have an invigorated effort in a bipartisan fashion to look at what is the balance in America between market forces and the fact that healthcare is a human right, and how do you create policies that empower people to get the care they need, and data that suggests that we can do it in a cost-effective way. Those are all very, very challenging issues. But until we face those, I think we're going to be in the midst of this food fight with a lot of people starving for healthcare.
Thank you, Randy. Thank you, Christin. Thank you, Rachel.
Thank you.
It's a really good discussion, and I hate to cut it off here because there's still questions to answer. But you're right. We spend more per capita in this country in healthcare than any other country on the planet, and we don't get the best results. So it's clearly our investment could be more targeted on people. That said, the Affordable Care Act open enrollment goes on until January. It's really important to get on there and look on plans. They have basic plans that will just give you a little bit peace of mind, and comprehensive plans that cover vision and cover dental. There's something for everybody. As I think our guest had hinted, if your costs are going up, you can go from a gold to a silver, or silver to bronze, or change carriers. But you've got to do so if you want to start January 1st by mid-December, by December 15th. So please go on to healthcare.gov. I want to say thank you to Randy. Thank you to Christin. Thank you for being here. Let's get as many people enrolled as possible and keep New Hampshire healthy, and fight for the Affordable Care Act, because it certainly fights to keep us all healthy. So thank you for joining me, and I look forward to talking to you both again soon.